We're then going to have some time with our child welfare executive leadership team, myself and my peers, to talk about the role of family preservation in the vision for transformation and in the organization and collaboration with self-sufficiency. You'll also get to hear from some of our self-sufficiency leadership about their work in this and their hopes and dreams for what we're going to accomplish together. And then finally, we'll hear from your leadership team in District 11 about the work that they've been doing and what they've done to prepare yourselves and your community to do this work. So that's our lineup for the day. We will save time at the end for questions, feedback, responses, thoughts. As you're hearing people talk today, if something comes to you that you want to ask, something comes to you want to mention, to suggest, please jot it down, because we'll have a good chunk of time at the end of our time together for that to happen. So with that, I'm going to turn it over to Fairvorce.
Thank you, Lacey. Good afternoon, everyone. Great to be with you to support the Child Welfare Vision for Transformation and the Family Preservation Kickoff. First, let me say thank you to all of you in D11 in Klamath County. You serve some of the most underserved children and families in child welfare and in ODHS. Whether your work is in child protective services, in permanency and certification, or if your work is supporting many of those functions within child welfare, your work makes a real difference for the children and families that we serve. And we all know that the work cannot happen without you. And next to the children and families that we serve, you are most important in the child welfare program, given that you do the work on the ground in the communities. The Child Welfare Vision for Transformation is focused on prevention and reducing and minimizing the number of children coming into foster care. It also strives to enhance in-home services to the extent that we can do that. It promotes adding resources, adding staff and structure, and also using continuous improvement and data in improving the system. I see the Family Preservation Plan as a really important component of the Child Welfare Vision for Transformation. We've known for a long time that children do best when they grow up in an environment of love and support with their own biological families. Sometimes that is not possible. And in that case, then the next best option is whether it is in an adoption environment or with in a guardianship or some other form of support. But regardless, what needs to be present is that the environment needs to be free from trauma, free from violence, abuse, and neglect. What I wanted to share with you this afternoon is why this work is so important, the family preservation, and the steps that we're taking at the ODHS level to enhance and build on this work, which ultimately can positively impact the nearly 1.5 million Oregonians that we serve throughout their lifespan and through our 5 program areas in this agency. We also know that the work that we do in one part of child welfare or one program within ODHS impacts the other parts of the agency. It can happen immediately, it can happen over time. Children grow up, they become adults, they may bounce back and forth between systems, and that can happen throughout their lifetime. None of you would remember this because you were not around. Many of you were not even born. 51 years ago, when a legislator from Corvallis, Oregon, his name was Robert Ingalls, and he carried a legislative bill on the floor of the Oregon House of Representatives that established Oregon Department of Human Resources at the time. He said that his intent for creating this agency, for the creation of this agency, was that he wanted to eliminate bouncing persons from pillar to post. He actually even offered an example of a mother on welfare with a husband in prison and a son that was experimenting with marijuana. And under the system back then, the family had to contact multiple different programs, had to basically be bounced back and forth. And his hope was that the creation of Oregon Department of Human Resources at the time would prevent that. Well, we've made a lot of progress over the course of the past 51 years, but we are far from fulfilling that original vision of creation of this agency. We still operate in silos within this organization, and even more so when we connect with other agencies that are critical to the success of our children and families. Our services and supports across the system, meaning with other agencies, public, nonprofit, etc., are fragmented. They're inequitable. They cause harm to communities, particularly the underserved communities, the tribal communities, communities of color. That does not mean that we don't do good work in our systems. We do. There is great work that happens day in and day out in this organization, and that is because of you. Thanks to you and our other staff from other ODHS programs. We also know that children and families need comprehensive support that cannot be provided by one agency, one program. And I know that you observe this, you see this, you deal with this in the work that you do every day. Many factors and elements must be present for children and families, and even for all of us on this call today, to be able to experience success. We all need stable housing. We need to live in safe neighborhoods. We need to have access to healthcare, clean air, clean water, stable employment so that we can actually support ourselves and our families. We need to have access to high quality education, access to childcare if we need it, and most importantly, a sense of belonging, support system, and a social and community network that we belong to. These elements by themselves, we know, cannot guarantee success, but at least they provide the capacity for individuals and families to begin planning for their future. If I'm worried about my next meal, if I'm worried about my next rent payment, that stress can lead to a whole series of other things. And again, you see this in your daily work. Trauma, anger, depression, addiction, suicidal ideation, and many other things that won't allow me to even ask the simple question, what's the purpose of my life? What do I want to become? What do I want to contribute? And again, the work that you do every day, I'm sure you run into this quite often. Some of those foundational factors for the children and families that you serve is missing. And as a result, some of our former foster children become parents of the next generation of kids in our system. We see our foster kids with a far lower high school graduation rates than the general Oregon high school graduation rates. And we all know the importance of education in earning potential. Another thing that we know, it's a sad truth, is that most of the youth in Oregon Youth Authority have been in foster care. And we also know that we as one agency cannot bridge those gaps that exist between systems, but we can collaborate better within our own agency and with our sister agencies so that we can bridge many of these gaps. To that end, child welfare and self-sufficiency leadership started work some time ago. And I know that you've been doing this at the local branch at District 11 for many months. I know Marita, I know her work, I know your leadership, I know that this work happens on the ground every day. We know the impact of TANF, SNAP, childcare, jobs programs, and how they can actually help lead people to success in our child welfare program. What we're doing at the ODHS level is also breaking down silos within our organization. The Child Welfare and Office of Developmental Disabilities program are working together to better address the needs of children with intellectual and developmental disabilities in foster care. The Vocational Rehabilitation Youth Transition Program is helping youth with a wide range of disabilities gain important job skills. And many of our older adults that are caring for their grandchildren and don't have enough resources can benefit through the programs that and services that we provide through aging and people with disabilities, self-sufficiency, and child welfare. As it relates for us working with sister agencies, system partners, we're doing that, we're beginning that work with Oregon Health Authority, with early learning, education, higher education, housing, employment, Oregon Youth Authority, and Oregon Department of Corrections. What we're trying to do is identify the children and adults that and families that all of our agencies serve. You know, these children and families bounce amongst our agencies. Then we want to identify the gaps that exist between our agencies and begin to bridge those gaps so that these children and families don't fall through those gaps. And you will hear a whole lot more in the coming weeks and months about the Building Wellbeing Initiative that is a mechanism for us to accomplish that. Equity is present at all levels, whether it is within the child welfare vision for transformation, within the family preservation, or within the Building Wellbeing Initiative. Our guiding light in doing this is our Equity North Star. And you know, the intent of that is to make sure that all of our staff and communities have the support and the services that they need, regardless of identity or place, wherever it might be in Oregon. Another important part of this is really relinquishing some power to the communities. Helping people with lived experience sit with us at the table and make some decisions. Reimagining ourselves and the future of human services in Oregon through the lens of those who are receiving our services, through those who are impacted by our services. And ultimately, our vision is all who live in Oregon, regardless of race, identity, age, disability, or place, have the needed support to achieve whole well-being for themselves, for their families, and for their communities. When I look at the Child Welfare Vision for Transformation, the Family Preservation Plan, and the ODHS Building Wellbeing Initiative, I see that they're all working together to help create better outcomes for nearly 1.5 million Oregonians that this agency serves. This work cannot happen without you. As I said in the beginning of my comments, next to the children and families that we serve, our staff, you who do the work, are most important to me and to this organization. You do some of the most challenging work in a state government, and you put your heart and soul into doing it. I am indebted to all of you for your caring and support. And please don't forget that my job is to be of service to you. And with that, I will hand it back to Lacey.
Thank you, Fair Bourse. I was watching as you all were doing roll call in the chat, and I'm so grateful to see so many community partners and stakeholders with us today. I'm so grateful to see such great representation across both self-sufficiency and child welfare. And I'm eternally grateful that we have people with lived experience in the conversation today. So welcome, and I'm looking forward to hearing y'all's thoughts and feedback. We're going to start off the Child Welfare Executive Leadership Team's thoughts about this work with Rebecca.
Good afternoon, everyone. Rebecca Jones-Gaston, she, her pronouns, Child Welfare Director. I am delighted to be with you today. And it took me a little bit to get myself together today because I kept talking about I wanted confetti and fireworks. And so I finally got the fireworks background going. We'll see tomorrow if I'm able to find a way to take it down. That'll be the test. But this has been such a great day across the board about really being able to celebrate the hard work that you all have been doing over this past year, and really thinking intentionally about what do we want our service to community, families, and children to look like. And an opportunity for us to think about how do we build on the things that have worked well, and where are the places that we need to do something different. And so what I want to do today with my remarks is really provide some, both, first of all, just gratitude. Gratitude for you being brave and courageous to be one of the three first folks to step out and say, we're going to try this out and we're going to build this together for Oregon. And then really just reassure you, we're inherently planners in a lot of ways, and we're part of a bureaucracy and a system that likes to give you a checklist, to tell you exactly what to do, to tell you when to do it, how to do it, all those sort of things. And we're really practicing how to do it differently, where we are not creating, we're not baking it all and then saying, here, here's this cake that we baked for you. We're saying, you know what we want to do is we want to be able to serve children and families, more children at home with their families in their communities. And we've got to figure out how to do it. And we need community, families, and young people at the table with us to figure it out. And that can feel a little unsettling, being used to, being told exactly how to do and when to do. But just know that this really is the best way to have something be created that is shaped by the community and in service to children and families, and in service to us as the folks, all of you that are out there doing this really hard work. We want it to work. We want to be able to live into our desire to have kids at home with their families, and ultimately some opportunities to do some of the things that you've already been doing on the ground, in partnering across our agency, partnering with the community and families, with our tribal partners. But I'm just really excited about this coming to fruition and looking forward to seeing how it grows and evolves, and some of the lessons that we're going to learn that we can then take with us as we're looking at all of the way in which we are working with children and families to really apply those lessons across our whole spectrum of care. And so I'm really excited and delighted to celebrate today. The hard work is ahead of us. And just know that, you have my support, you have our support across leadership in the uncomfortable path of figuring it out as we go, and then documenting about what works so that we can lead the way for Oregon's work with communities, children, and families. So just thank you. It is much appreciated, and I look forward to continuing to hear about the great things that you're doing. So I will turn it back over to Lacey now.
Thanks, Rebecca. Yeah, you may just see us with confetti and fireworks, so we'll just find things to celebrate if we can't figure out how to change our backgrounds. One thing of note of appreciation and thanks from me for you all. You have been one of the first implementers of the family report and the statewide case transfer protocol. You helped us pilot that. And so you're more familiar than most of your peers about what it's really like to be working on a project where we're utilizing continuous quality improvement. I would just note that although you are small, you are mighty, because your case plan timeliness and your management of timely safety assessments is some of the best in the state. And I appreciate that. And that gives me a lot of confidence that you have the foundation in terms of the practice to really move this work forward in a really dynamic way. What you'll find, even more so than with the pilot of the family report and statewide case transfer protocol, is that we're building this, like Rebecca said, acknowledging that we don't know everything yet. We're going to really provide opportunities for people with lived experience, who I would include our workforce, who experiences our system every day, the families that we serve, both parents and children and young adults, as well as resource parents, to be able to give us a lot of input and feedback that we're using to change what we're asking people to do. And over the course of time with the 3 demonstration sites, you're helping us work out the kinks, helping us figure out what works and doesn't work. And that continued opportunity for feedback from our stakeholders and from all of you is going to be really important in getting us to the right space to move this work out statewide. So it is different because we're not coming out with the procedure written and the rules done and the business protocols and saying, go forth and conquer. We are coming to you all saying, help us figure out how to best do this work and to best serve children and families who are experiencing the system. So it's a bit of a new way of doing things, but it's a very exciting way. Okay, I'm gonna hand it over to April.
Good afternoon, my friends. I'm really excited to be with you all here today. April Flint-Gerner, she, her pronouns, Deputy Director with ODHS Child Welfare. I am over equity training and workforce development. And so I just thought I would take a couple of minutes to share a couple of things that get me really excited about this work. So first, I'm really excited about having an opportunity to do the least intrusive intervention with our families. And I had thought about like all the things I wanted to say about that. And then I thought, no, you all actually have the best answers to that question. So first off, this is an opportunity to participate. I want you to grab that mouse and grab that keyboard. I want you all in the chat, the dogs have something to say about it. I want you to share with all of us, what is the cost of us being overly intrusive in families and communities' lives? What is the cost? So just start throwing it in a chat, and I'm going to call some of these out. I bet you're going to have some of the same thoughts that I had. Lifelong trauma, lack of communication, loss of confidence, emotional impact, increased suspicion. Yes, keep going. What's the impact of us being overly involved? Harm to attachment, alienation. Yes, disengagement in community. Historic trauma, absolutely. Shame, poor image. What's the impact to you as staff when we are overly, there we go, Josh. Overwhelmed workforce, lack of trust, community perception that we do not help families. And the list goes on and on and on. This is absolutely spot on, right? So what gets me really excited is just us really kind of just broadening our horizons around how we have inadvertently, because I don't believe that any of us show up at work thinking we're going to do all of those things, right? That's not why we got into this work, but the power of our system. We have the kind of power that leads to those kinds of things. And so when we have an opportunity to really walk alongside community to lessen our need for intrusive intervention, the hope is that one, that we can regain some trust, build some rapport, maybe heal some trauma, and we can change some of the public perception about who we are and what it is that we really do, right? And then the other thing I would just say is that this opportunity for family preservation, and the other reason I'm really excited, is that link between our equity efforts, our anti-racism efforts. And so I want to be really clear by kind of painting a picture of how I see it. When we look at those children and families who have kind of the worst outcomes in our systems, those who have not been able to achieve timely permanency, those folks who maybe are experiencing our system as not in a least intrusive way, but where they're feeling overly surveilled, right? If we were to put kind of a goalpost in the middle of a room, and let's say we made those good child and family outcomes, good community outcomes, thriving families, we put that goalpost in the middle of a room and we asked ourselves, who is the farthest from this goalpost? Are there children and communities that are outside of the room, down the street, around the corner? Can they not even see the goalpost? And in my definition of equity work, we are moving barriers out of the way so that folks have access to the goals that we all say we are here to support. And so this opportunity around family preservation is coming alongside families, really trying to lift up those barriers. That's why, Rebecca talked about this being kind of messy work, because we've got to get out of the notion, and I'm not saying you all do this, this is really a child welfare thing. We've got to get out of this notion that we're going to come alongside folks, or we're going to show up and fix people, right? That we're the answer, that we're the experts in other people's lives. So here's my second question for you, and it's opportunity for participation. Raise your hand, literally turn on your screen, raise your hand, or give me a heart if you truly believe that children and families can be safe that communities can keep their children safe? I see hands. So Rebecca, look, I see hands in the car. I see hands, I see hearts, right? We have this belief that communities can actually keep their children safe. And one of the things we struggled with is a lot of times folks don't really know what we mean by safe. I fundamentally believe that children can be safe even when their families are in crisis, that children can be safe even when their families are struggling with drug addiction, with mental illness challenges, with poverty. Children can still be safe and families can still be complex. And so I think about this opportunity to both partner with families, really see the value that they're bringing to the conversation. They are not less worried about their children than we are. We have to lean in and listen. We have to be willing to acknowledge when we've gotten it wrong. We have to support the basic right to human dignity, empathy, and respect that all of our communities absolutely deserve. And sometimes that means us just humbling ourselves, right? Practicing the kind of humility that really builds a different kind of relationship with our workforce, and really showing up to say, not how can we fix you or what's wrong with you, but can we be of support? Can we be of resource? Can we help connect you? Can we make sure that the community is wrapping around these children instead of it being us? And so I'm absolutely thrilled about family preservation. Most of my frontline case practice in California was as a family preservation worker. I think it's just the heart of the work that we do. And so I'm thrilled to be here with you all today in this kickoff moment. And I'm just really excited to learn alongside of you what it looks like to do things a little differently. We're going to be, cheering you on and trying to provide support and open to your feedback and trying to help move barriers out of you all's way as well. And so I just, really want to thank you all for all of the hard work that has gone into getting us to this day, and just wanted to send my heartfelt support for this work and really excitement about what the impact is going to be to communities. I know that it won't happen quickly, but it is absolutely the right thing to do. So with that, I will turn it back over to Lacey.
Thanks, April. Two more things from my perspective, and then I'm going to ask our team in self-sufficiency from design to share their thoughts as well. The first one is, a lot of people have asked or wondered what's different about this work, what's new or unique, why are we having a kickoff? Because if you know rule and procedure, which likely most of you do, we can serve families in home currently under our rule. We just haven't built the infrastructure around it, haven't done the community analysis about what's needed outside of just child welfare supports for families to do well. And then third, that we need to ground ourselves in values of practice. We started this with life. We worked on it a little bit more with the rollout of the family report and statewide case transfer. For some reason, that one's hard for me today. But really, starting from this point, you'll see these values reflected in the vision for transformation. And if you've worked with Holman or I for any period of time, they're not going to sound new, but they are strength-based, trauma-informed, culturally responsive, parent-centered and parent-guided and youth-centered. And the way that those values will function is much like you've heard us talk about the vision for transformation itself. As you're gathering together and talking about the work, some things you can say are, how did being culturally responsive show up in my work today? Where did I remember to engage the parent from a place of giving them some power and hearing what they needed me to know? Those are questions for staffing. Those are questions for group supervision. Those are questions for unit meetings. The other place that those values really come into impact nicely is when things don't go well. It gives you a structure to start thinking back at. What did we miss? What didn't happen that the family needed? So that might be a family meeting that doesn't go well. That might be a home visit or an interaction between a worker and a parent, or a team and a family. And really thinking through, if I'm embodying in my actions and behaviors those values, we should get to a result and an outcome that we want to get to. The one other thing I wanted to talk about really quickly is that you've heard us talk about workforce development and the way that we're intervening with families, which covers guiding principles 1 and 2 of the vision. But the third guiding principle of the vision for child transformation is a commitment to our utilization of data and data-informed decision-making. And where I see our long-term strategies being, We want to serve families safely in home and never have to separate for the purpose of foster care. And we want that work to be done in such a way that we're long-term impacting disproportionality and disparity. We're going to start with you all by looking at the populations of families that we're serving during open assessments, the populations of families that we're serving in home, and the populations of families that we're serving after we've reunified children and we're keeping them safe in home. And looking at where are we missing services potentially that are causing some families to have to cross those barriers into foster care, and also keeping a very close eye on the representation and makeup of groups. Because what we are committed to not do is create another system within this organization and child serving system that disproportionately or disparitably impacts any particular population of people. We want to see equitable service delivery across the dynamics, the demographics, the makeups of the families that we serve. And we're going to use data to do that. So a plug in protection for your supervisors when they're asking you if you're entering placements timely, when they're asking you if you're opening the non-paid placement types, when they're keeping a close eye on your caseloads and your data, they're helping us get the picture of what's working and not working. And that really is your involvement in being really data informed as an agency and organization. I'm going to send it over to our self-sufficiency team.
Hey, Lacey, it's Jana. Let me introduce myself. Jana Mcclellan, Interim Director of the Self-Sufficiency Division. It's a complementary division with child welfare. It's nice to see some of you having worked in child welfare before the pandemic. There are some new old faces or old new faces. We're all a little bit older than we were 2 years ago. I stepped out of child welfare for a couple of years and worked on some of the COVID response work and have been for about the last month back with self-sufficiency. I've got a lot to learn. The first thing I should learn is that let me introduce myself with my pronouns. I use the she, her series. And for those of you that are like a visual representation, I have short gray hair, Caucasian, reading glasses, and a peach colored shirt on with tigers. Not as good as confetti, but I have tigers on my shirt. What I wanted to do is maybe just echo what everybody has said. And I too love seeing both our community partners on this call and so many people from D11 to really hear about what it is that child welfare is trying to lead, but also affirm for you that child welfare is leading that with the support and in partnership and alignment with self-sufficiency. One of the reasons that me stepping back into DHS has excited me is actually stepping in into self-sufficiency, a program I don't know a lot about, but a program that I know serves so many of the same families and kids that child welfare does. Regardless of which program is serving our kids, we know that our families in community need to be the ones that are leading us and leading our work for what community needs. So really love hearing both. So many community partners are on this call, our tribal representation, as well as our nonprofits and CBOs, but also knowing within the district that we've got really good and exciting leadership. I was given 2 pages of talking points to make sure I don't go off script. Just know I'm not going to stay on script, because really what I want to do is share my excitement for what both Fairborse and Rebecca and her team have shared. And that really is about the transformational work and the innovative work that's in front of us. It's also about the messiness of the work. And it's about having the hard conversations, which are the right conversations with us, central office leadership, with you, each other within district, and listening to our communities. I like to remind folks that the listening to community is half of it. The hearing the community is the other half, and sometimes the more important half. We have done an injustice in my mind over the years of listening to community and not closing the loop of hearing them and acting on what you all are recommending. So as I've learned for the last 2 years with the Oregon Health Authority to really move towards building an anti-racist organization, one of the things we have to do is engage our partners, share the power, which is the money, and ultimately hope that we are giving the money to our community partners to do the work that they need to do with our families and children that all of us know we are committed to. So for me, that means we have to ensure the voices of our tribal partners, and it means we have to ensure the voices of our marginalized folks and the people that don't trust government. And that's what we represent, even if we say, trust me, because they don't. And we've given them good cause over years and years and years and generations at times of not trusting us. So how do we regain the trust, rebuild the partnership, and really listen and hear what we're being told, even if we maybe don't agree with it, but that it holds our values, as Lacey and others have outlined them, really holds that value. So it's a culture shift, and culture shifts are hard. They don't happen overnight. They don't happen next month. But if they start next month, and if they start overnight, we know that over time, we will make change. The exciting thing for me, frankly, is as a demonstration project, really getting to learn from you all where you struggle. We know you're not going to get it right. We actually hope you don't get it right. We hope that you help us learn and you teach us what we can do and how we can support you and our communities differently and better as we try and learn from 3 demonstration projects and then take it across the state. So I want to just kind of confirm that and affirm that. It's built on hard conversations. It's built in relationship. It's built in listening and hearing. Super excited to be partnering up with child welfare to see where we can take this. Know that my role as the interim director of self-sufficiency, as well as our leadership team's role, is really to make sure this is as successful as it can be, to really bring the intentional collaboration across the state, but starting with you all. Lacey, I'm going to kick it back to you, and then I think you're going to probably kick it to somebody who doesn't have confetti behind them, but is equally as excited.
I'm always willing to share the virtual background, so let me know if you need a little confetti in your life. I am going to ask Marita and her leadership team to talk about the local leadership's engagement and what they've been doing to get community and our teams ready.
Great. Good afternoon, Marita Johnson. I'm the district manager here in Klamath and Lake. I also go by she, her pronouns. First, I just want to thank Lacey for answering our hand when we eagerly raised it up to be a part of this. It's really been an honor to participate in the development of this. And there's several reasons why it's an honor, but one of the things I wanted to say is that this is actually a dream of Gina and Greg's, who, for those who don't know on the call, are the Child Welfare and Self-Sufficiency Program Manager. They got together 7 years ago, and I'm going to let them comment on an idea about how to create a continuum of safety and stability for families. And that's evolved over time. And it's been really great to have the opportunity to be able to merge that work into a statewide thinking on how we can really preserve and serve families. And I just want to give a big shout out to them, because this is something that they've been working on for many, many years. And I just was able to merge into that really great work. The other comment I want to make is I'm also very appreciative of having the opportunity to be able to surface systemic strengths and barriers, and really be able to think through how maybe our work as an agency sometimes gets in the way of serving families, and appreciate the openness for us to be able to bust through those barriers and really streamline our service array all along the lifetime of a family as they're involved in both child welfare and self-sufficiency. So I'm going to quit blah, 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 because this really is also a celebration of at least a 7-year effort of Greg and Gina, and I would love to have them speak a little bit about that.
I usually like Greg to go first.
And why would that happen? You're the talker of the bunch.
Hi, I'm Gina Moppin. I'm the program manager at Child Welfare. I wanted to start by emceeing many of our community partners, which is really exciting. We were able to meet with many of them. I see Jay and Tara from KBVH and Christina from class and Dawn and all of our parent mentors. I think I see them all. So I'm really excited that you guys could make it. The other part that I've seen is, or want to recognize, is I also see Danae, who's our family preservation worker, and our supervisor, Aaron Rogers, who we couldn't even have begun to do this without those partnerships right there, including our self-sufficiency partners. We've already learned a lot starting in. We're a group that just likes to start. Danae's already carrying cases, and we're already learning things from those cases. Every case has a parent mentor as well as a family coach, and we've already seen some great outcomes from those, where one of our parent mentors, to give Lisa Bickert some kudos, there you are, she had a parent who said, we were ready to dismiss our case, and she said, I don't want you to dismiss my case if I'm going to lose Lisa as a support. So we were able to figure out the behind the scenes funding so Lisa could continue to work with them. Thanks to TWC and that program for working with us to do that. So we learned a lot, and we'll continue to learn, and we're excited for the opportunity. One of the most instrumental part of this program that we see so far is that we have to have that relationship. I don't think any group will survive this without their relationship with self-sufficiency, because we've had the same experiences in self-sufficiency where we're ready to dismiss a case, but they still continue to have the support of their family coach. So we're really excited. Go ahead, Greg.
Yeah, I want to echo everything Gina said about the partners being on board and all that stuff. And, this started out just as a little idea many years ago about how we could help keep families together, and work together with child welfare and stuff. And we've been doing this 7+ years. I've dedicated some family coaches. The relationship has just grown and grown. Again, we really love our child welfare workers. They're great to work with. And they really enjoy working with us. Having that point of connection really makes a difference. And we talk to each other daily. We go out on cases with them when they want us to. It's worked out really well, and we've seen tons of successes. The families we go out and visit that don't rise to the level of child welfare involvement are really appreciative of us coming out and checking in on them and stuff. And a lot of them, even after their cases close, still connect with our family coaches. And actually the caring, we're not here to take your kids, we're here to help your families, we're trying to keep you together and stuff like that. So it's been a wonderful relationship. And again, I'm so appreciative of all the managers and employees down there at the child welfare office, because it really has worked out well. So, and we're excited to be one of these pilots, and it's a demonstration project, I guess is the word, but so excited, and hopefully we'll learn a lot more from this.
And finally, I think I just want to add, I really appreciate the thinking about data and studying this. One of the things that Greg and Gina and I talked about early on when they were walking me through what they've been doing is, oh my gosh, how have we collected data to be able to show the benefits of this that we know just anecdotally. And so really appreciative of having that overlay as well, because for a very long time, Gina and Greg and now myself really believe that that this is a great way to serve families, and we would love to be able to say, and this is why, with numbers. So I just want to add that last piece.
Thanks, Marita. And thank you all. Yeah, I think to that last point, Marita, it's critical that we're closely analyzing that and keeping an eye on that, because sometimes we make assumptions about who we're going to impact or how, and that's the way that we check that, right? So now is the time in the agenda for you all. I would love to hear your thoughts on what you've heard, any questions that came up for you, considerations that you think are important in this conversation. Really open forum for discussion and input.
It's not the time to be quiet.
Is this open to everyone or just the group from your counties?
When have
Everyone.
we been able to tell you to not talk, Rolanda?
Rebecca, you're gonna remember me when you leave. Where's that
I
annoying
am.
person that constantly talks?
And she's gonna miss you, Rolanda.
No, I was just gonna ask, how long do you see this demonstration happening before other counties can actually start to think about, incorporating this in the work they're doing? Because I'm also excited, but I, like Jana, don't know how to do any backgrounds. And so
We can help with that, Rolanda. So my best thinking and what I know right now in terms of just good implementation is that I think we see how quickly things are changing in the 3 demonstration sites. What we've seen in other places where we implement this way is that there's kind of some fast and the furious at the beginning, lots of conversations and adjustments. And then over time, that starts to settle in, and then we see less. So I think as we see that bell curve of input and adjustments to practice coming to a flat plane, that's the time that we look at moving out. Having said that, we'll be working on for other counties in the state like Washington that are very interested and excited about being next in the true family preservation rollout. We'll be looking at some preparation. We'll look to these folks about what they've done with their communities, talk to you about, I think you may have heard me say at the beginning, case plans are very timely in Washington County. They're managing their safety assessments well. They had community partners engaged. Really, they've been doing this work for years. You just heard Greg and Gina talking about that. So those are some of the things we'll be considering. And we take the input of leadership in the districts very, very highly as well. So I don't have a set time, but you'll be hearing from Marita and the other 2 DMs about how it's going on a regular basis as well. So you'll have a sense of when we're ready to start considering other locations. Who else?
I wanted to add something really quick. So my name is Jessica Hernandez. I am the meeting facilitator here at D11. So I've gotten to facilitate some of the meetings for Danae for some of these families that she's already working with. And I just wanted to give her a big shout out because she's done a lot of work trying to keep things together for these families. So I don't think that's one thing I think to think about, is that it is a really heavy caseload that you're carrying. It's a lot of work to do. And I think she's done a really awesome job. So there you go.
Well, Danae, thank you for being a trailblazer. I don't want to embarrass you, but I'd love to hear if you have anything that you want to add. I think you're right, Jessica. You play a really important role in planning and safety provision as a caseworker when your families are being served in home. And thank you for being brave and being willing to step into this work with us and learn some things. And so I'll leave it at that. And if you want to add anything, please feel free, but no pressure.
I'm just going to say thank you.
And my gratitude extends to Erin as well for being willing to supervise.
Thank you. I will second what Jessica was saying. And, Lacey, we had all had a meeting a little over a week ago. And I think that was one of the things that I said I thought was really important in this, is that there's a good match for who does the work with families. And I think that Danae is definitely a really good match for it and is doing a really good job. And, I listened to her conversations with families and she's really engaging. She's building relationships with individuals that I think is really important. And she's able to, connect them to others in the community and really set up a strong support system for them, which is ideally what we want to have happen in all of these cases, is for these families to have that support in place when we step out, so that they continue to have, that community support and people that they can turn to when child welfare is no longer involved. So.
Yeah, Erin, that's so critical. And, you all saw from me a couple months ago now, it's already been an email with our Oregon Caseload Ratios document. And then you saw lots of caveats around it that we're going to keep working on it and keep learning things. And this is one of the areas where we need to just practice for a while, because right now we have the caseload set at one family preservation worker to serving 12 children, but it may be with Danae and her input and the other folks across the state who are doing this work that we may need to consider changing that once we actually see, because we also know that in this setup for a family, the caseworker becomes a safety service provider. They become someone who's a change agent for the parent in the home. They're a critical part of case planning in a way that maybe when we can offset some of that to resource parents is just different, right? So I appreciate that very much, and we'll continue to listen from you and learn and hear about how things are going as we look at what that exactly the right ratio is. Anybody else? Thoughts, feedback, questions?
I know for a fact this is not a shy group.
The one thing I forgot to say in my opening spiel was that we're very pleased to have gone through a recruitment and hiring process. We have selected a candidate who is going to be and has been heavily in this work, the Family Preservation Program Manager. She's with us today. It's Jennifer Holman. If you've worked with Jennifer, you know the passion that she brings to this work, and alongside her other role with program has been really integral in working through the design of where we are so far with family preservation. So we're excited to have her in the work and confident that she's the right leader to continue to move this forward. You want to say anything?
I knew you were going to say that next. Yeah, I'm super excited, everyone. I also been saying this to a lot of folks, taking a lot of deep breaths. This is exciting work, and I just think it's just been an absolute pleasure. I've worked with Marita for a long time. When I was a caseworker, she was my district manager in Clackamas. She was my mentor for a leadership program that I went through. And I've just really had the pleasure of getting to know Gina a lot more through this work as well. So I'm super excited for you all and the amazing work you're already doing. And I just feel like with this branch, we're just learning from you all and hope that we have something to offer you in exchange for that. So I appreciate all the work that you've done, and I'm just super excited to continue to work with all of you in child welfare and self-sufficiency. So really looking forward to it.
Hey, Jennifer. One thing that I will just call out, this is Rebecca again, that I'm actually looking forward to in all of our sites, but really particularly this location, is the work that you've been doing over the last several years around rebuilding the relationship with Klamath tribe. And that work just absolutely bridges so beautifully. And so I think there will be some really important things that we'll learn about the effort around being partners, real partners with our tribes and this family preservation work. And what are the things that we need to kind of think about in the back and forth and the ICWA expectations and the the family preservation pieces, and where it is really clear and where it's kind of a little muddy, and we've got to sort some things out. So just flagging that for you all, that I'll be, I think that's one of the things that we're going to definitely be learning from the fact that you've got a well-established relationship and partnership that has lots of potential for continuing to grow this work in that partnership. So warning to you that I'll be asking questions.
Well, I want to thank you all so much, both the teams from Self-Sufficiency and Child Welfare and in design, as well as you all, Greg and Gina, Marita, and Aaron and Danae, and the work that you're already doing in the branch. I'm excited to see what's possible. And like Rebecca said, we'll try to keep up and learn from you, because you're leading the state. So you're one to watch. I appreciate it so much. Have a great afternoon. Thank you all. Happy Family Preservation Day.
You're good. Take care.
Thank you.